Welcome, everybody. My name is Holly Gerstlin-Becerra, and I'm with my colleague Jenny Baldwin, and we are the co-directors at the Texas Institute for Excellence in Mental Health for Early Childhood Initiatives. We're excited to be here with you today. We just wanted to give you some context and connect you to what is infant early childhood mental health consultation. We want to ground ourselves in the why this is so important for Texas, what we're hoping to build, and what we want you to know as you leave us today. Our hope is that you have a really clear understanding of what consultation is, and then a sense of how it fits into the bigger picture of early childhood continuums of care. So as we know, the concern for mental health for children and their well-being for infants and toddlers is growing, and there is a larger interest in what's going on for our youngest. Consultation, infant early childhood mental health consultation, is emerging as a powerful evidence-informed strategy that supports the child's well-being, builds caregiver capacity, and reduces challenging behaviors in our youngest. So we want to take you on a little journey, a little behind the scenes, lessons learned from our work here in Texas, roadblocks that we had, and some major wins that we're working on along the way. There's an exciting amount of attention going on to this topic right now, both locally and nationally. And so we want to share that information with you today. So we want to talk about, and what we're hoping you're going to walk away with, is a clear understanding of what consultation is and what that acronym stands for. You'll hear us say it a lot. What we hope to achieve, how Texas is envisioning this larger system to support young children, key strategies we're using to implement services, what we learned then from our research and our ongoing program work, how the first of its kind model took shape for our state, new findings from our pilot demonstration and an evaluation we conducted, and finally, what's to come. So let's just start by doing a little bit of level setting. Infant early childhood mental health consultation is a service provided by a licensed mental health professional who works with adults in a child's life. So those adults can be teachers, home visitors, pediatricians, caregivers, early intervention specialists, parent educators, case managers, you get it. These consultants have expertise in child development, infant mental health, adult mental health, and they understand that children grow within the relationship between themselves and their caregiver and all the nuance that comes with relational health. An infant early childhood mental health consultant works to support those early childhood providers, teachers, caregivers by providing knowledge and expertise about a child and family's needs in context of that child's development, the family's background, culture, and environment, and always with a mental health lens. By helping adults better understand a child's needs or behaviors, the consultants are building that adult's capacity to care for, understand, and support children. Those adults then that we work with, they're going to learn from the experience with their consultant and go on to impact all children in their class, on their caseload, or if it's a parent, they're going to positively impact the relationship with their child. Although Texas has a multifaceted children's mental health systems of care, when it comes to meeting the needs of our youngest children and families, especially birth to 5, many states are opting to include infant early childhood mental health consultation as a key component of that continuum. And that's because it is a mental health promotion and prevention service. So it's designed to bring mental health expertise and supports into natural settings for early childhood, and uniquely can be implemented across an array of child-serving programs. So it acts as a bit of a safety net of sorts, and it can be seen to support the well-being of children and families across all of our different spectrum of programs. Infant early childhood mental health consultation is a strength-based program. It acknowledges the expertise of the adults and caregivers, families and communities, and it's adaptable because it can be done in different programs. For more information, we're going to encourage you to visit our website, IECMHC.org. Under the resource tab, you'll find all of our early childhood initiatives work. So we talked a little bit about how Texas is defining infant early childhood mental health consultation, which to note can be slightly different from other states. But what are we aiming to do with it by bringing it here? And what do we hope to accomplish? Well, infant early childhood mental health consultation promotes healthy adult-child relationships, reduces challenging behaviors, reduces provider stress, burnout, and turnover. It improves adult knowledge about social emotional development, And all of these outcomes are driving the work in Texas and what we hope to achieve. As we alluded to, many states have been implementing consultation and some for over 20 years. There is a national website called the Center of Excellence that helps states create programs using best practices in mind. They have a list of growing outcomes and impacts that are related to infant early childhood mental health consultation. And yet, if you're sitting with us here and you're scratching your head a little bit about what is consultation and kind of where does it fit into it all, let's talk about what it isn't. Consultation can actually be better understood at times about saying what it's not, and then it also reduces stigma around infant mental health, in that it is not direct therapy, it is not play therapy, it is not family therapy. It is pairing a consultant who has expertise in mental health and well-being to the adult in a child's ecosystem, mainly providers and caregivers, to increase their understanding, their capacity of child development, trauma, relational health, and then understanding how adults' mental health also impacts a child's development, with the goal of promoting healthy relationships between children and adults. Consultants are master's level licensed mental health providers. So someone who went through a mental health education program with distinct years of training with mental health lenses, who specializes in child-focused mental health, development, reflective practice, and understands how the relationship between adults and children develop that child's mental health. To help define who these individuals are, in our state manual, which we'll talk about later, lives a set of competencies or knowledge that individuals have to have in order to do this work. Establishing these competencies as a common thread across states, laying out standards that this role would need to have that makes them unique. To set the stage for how we're envisioning consultation in Texas, what the framework is, we want to share the core values that have been vetted and adopted by several of our state agencies to drive infant early childhood mental health consultation work forward. The mental health of children is intertwined with the well-being of their caregivers. Consultation services must be research informed. It helps to bridge gaps in early childhood systems of care. It helps to promote fairness and recognizes that children have different resources and opportunities to thrive. Mental health consultants need ongoing support and training, and family voice is an essential component of effective services. Now we want to show you how consultation fits into our larger system of care. Consultation, which you'll kind of see there circled in red, it means to fill the gaps related to serving and supporting the youngest Texans' social-emotional well-being. Consultation can uniquely cross the continuum of care within the promotion prevention space, and then consultants will be making quality referrals for treatment if needed. Consultants would work in tandem with teachers, childcare centers, community service centers, ECI teams, home visitors, pediatricians to support the adults that are working with those children. So in the promotion space, they are sharing information, knowledge, research on children's development and context for their environments and relationships, and they're talking about developmental milestones. They're conducting and scoring screenings to help providers build their confidence around screening and referral. And they're sitting in team meetings for case consultation, support, reflective practice, providing trainings and mentorship, and attending community outreach events. In the prevention space, they're providing parent education support, relational health understanding in groups, and training on topics related to infant mental health. Then crossing again the continuum to making quality referrals if additional assessments or supports are needed for child and family in terms of treatment. So where would we see this happening? One place you can find consultants are in schools who have what we call organizational readiness, meaning that they have the infrastructure that's prepared to support consultants. In a school, that would mean in pre-K classrooms, where we have access to teachers who have access to children and their families. You can also find consultants in local mental health authorities or community-based mental health centers. They have the means to hire, employ, and deploy a consultant. They'll have clinical teams, have means to support reflective practices, have the relationships with school districts, early education settings, and it can usually serve general regions. One consultant can actually serve a broad area if they are employed within those local mental health settings. Schools, local mental health authorities, community-based behavioral mental health settings, they're not the only places that you can find a consultant, but they'd be the right place to start looking for them. So how do consultants work with other providers? This slide is just helping give you an example of how they are both unique in their work, but also collaborate with other providers. So for example, a behavioral analysis specialist helps staff and families support the development and well-being of children on the autism spectrum specifically. A pyramid model coach helps staff promote social emotional competence in infants and young children using a very specific curriculum in the early education space. An inclusion specialist or a member of your regional workforce board is working one-on-one with families in early education settings to help families apply for and maintain a subsidy program. Children must have a medical or mental health diagnosis from a professional, an IEP, or be receiving SSI funds. An infant early childhood mental health consultant then works in coordination and collaboration with other early childhood specialists to attend to the mental health related aspects of that child, family, and staff member in order to help them with their experiences working with children. An example, a consultant is identifying a mental health co-occurring issue for a child who might have a developmental disability. They recognize additional evaluation is needed and facilitate referrals to community-based centers. They create safe spaces for staff to share challenges they're having working with children or children with special needs, and hopes to reduce secondary trauma, reduce burnout, reduce stigma, reduce bias. They can offer support resources, referrals for families. So if there is a parent struggling with depression after a diagnosis of their child, they're helping staff to understand how parental behavioral health issues and our family environments are impacting a child's behavior that may or may not then be crossing into the classroom. So working on all of those different aspects in tandem with other providers.
So let's talk about what's been happening in Texas. So here in our state, we've been supporting mental health consultation in 10 counties across Texas in recent years. And this has been occurring with two funding streams. The first is called Project Launch, and that is one we're in our third year currently, running through September 2026 with the possible extension for 2 more years. The second has been through the Preschool Development Grant, Birth Through 5, which was originally awarded in federal fiscal year 23 and ran through March 2026 due to a no-cost extension. Our institute, the Texas Institute for Excellence in Mental Health, is serving as the state's training and technical assistance center for infant and early childhood mental health consultation in Texas. Each of the sites listed here employs at least one infant and early childhood mental health consultant that provides services to local ECI, early childhood care and education, home visiting, and medical programs. So if you're interested in connecting with one of these programs, please reach out to us at IECMHC, and we would love to connect you to the programs you see listed here. We're currently seeking other funding opportunities to sustain this work, as well as to grow the work further across the state. And we anticipate that one such opportunity to sustain those efforts in early childhood education settings will be coming in the next fiscal year. So through the Preschool Development Grant, or PDG as we call it, TimeH was able to research and author two sister reports. The first was where we conducted a landscape analysis of existing programs here in Texas and in other states. We surveyed or interviewed programs in Texas providing mental health consultation and 13 other state programs. We published an implementation science report with a set of recommendations based on the findings of that landscape analysis for how to establish a Texas program. This was a super unique opportunity that we were able to take a full year to research and plan, talk to other states, learn from their expertise, and consult with others. And many states that we spoke with did not have that opportunity. We also developed outreach and engagement collateral to support increasing public awareness and understanding of infant and early childhood mental health consultation here in Texas. Mental health consultation is a nuanced approach that can seem nebulous at first. For many, it's a see it to understand it kind of experience. So to help curb that hurdle, we have some materials that we created in partnership with the Center for Health Communication at UT to educate professionals and families about consultation. So the brochure here was created for early childhood systems and families to begin sharing common language and understanding about what is this thing called infant and early childhood mental health consultation. The overview document was developed specifically for professionals and includes impact and recommendations. There are also 3 videos that show what mental health consultation looks like in specific settings, namely early care and education, ECI, and home visiting. Finally, for implementation, we are very excited to say that the state program manual is online and able to be downloaded. This was recently published and includes guidance for program implementation regarding orientation to infant and early childhood mental health consultation, core competencies, training and onboarding that's necessary, and program evaluation. Our national scan work that began with PDG continues today. And in fact, to date, TIMH has interviewed 17 states and growing. We also attend a national community of practice related to infant and early childhood mental health consultation and regularly collaborate with the National Center for Excellence for Infant and Early Childhood Mental Health Consultation. We learned that most states have been using non-mental health, non-behavioral health dollars to support infant and early childhood mental health consultation. Some of these are also short-term funding sources like ARPA, which is the American Rescue Plan Act, which has ended for now, or PDG, like we did here in Texas. We also learned that state general revenue dollars with legislative support are an important component of sustaining this work long-term in a state. Many states are also exploring how to use Medicaid to support mental health consultation. But this can be tricky because for many of the cases, the consultant is working directly with the provider or the adult and the family, and the child may not be present at the time of service, which can be a requirement for billing in some states. To date, only 2 states have achieved this. As you see, Michigan was the only state that was achieving this at the time of our interview. And recently we've learned that Georgia has also begun billing to Medicaid for services. A link is provided on the slide that you can look at to investigate further how they are doing that. In Texas, we're requiring that mental health consultants be licensed mental health providers, which tracks with the majority of other states and their programs. Infant and early childhood mental health consultation was first developed for implementation in early childhood care and education settings, so it's really no surprise that the majority of state services across the U.S. are provided in those settings. And in recent years, we've seen a big uptick in states also providing mental health consultation in home visiting programs. And then in the past year, some states have also begun to explore how do we do this in early intervention programs like ECI here in Texas. And in our state, we're supporting it in all 3 of those, as well as in primary care settings. So as we mentioned, we've created the Texas Infant Early Childhood Mental Health Consultation Program Manual. And to create this manual, we worked with national subject matter experts, such as the National Community of Excellence, the National Center of Excellence, and other consultants. We also used the findings from our landscape analysis, and we got input from our community-based implementation partners. So the goal of this manual is to create a universal understanding in Texas for what infant and early childhood mental health consultation is. And that includes defining what infant and early childhood mental health consultation is through explaining foundational competencies of the work. Who can provide this service? What's the training necessary? And the recommended evaluation strategies and tools to measure impact. The state manual includes 4 areas: orientation, competencies, training, and evaluation. The orientation section sets standards for infant and early childhood mental health consultation services in various child serving settings, and will answer the question of what is infant and early childhood mental health consultation? Who provides it? Where does it happen? How does it happen? And when would it happen? The competency section provides an outline of the foundational knowledge that an infant and early childhood mental health consultant would need to be able to provide this work. It defines the role of that consultant within the larger system of care and outlines best practices for the integration of reflective supervision. The training section encompasses 3 levels of professional development: required training, recommended training, and optional training. It also outlines the foundational training and onboarding a new consultant would need to do this work. The evaluation section provides guidance to programs implementing mental health consultation. It includes a theory of change and logic model, as well as how to develop an evaluation plan and recommended tools to track impact with infant and early childhood mental health consultation. We also included an appendix in the manual filled with tools to aid infant and early childhood mental health consultation. This includes a sample budget template, a goal setting form, a job description, and many more other tools. There is also a one-pager that describes what infant and early childhood mental health consultation is and what it is not. And we found that that sometimes is really helpful in how to explain what mental health consultation is to new people.
So now we want to talk about the how. How did we think about all the different puzzle pieces that brought this work together and bringing this to our specific early childhood system? We wanted to improve children's social skills and emotional functioning. We wanted to promote healthy adult-child relationships, reduce challenging behaviors, reduce the number of suspension expulsions from early care and education classrooms, reduce provider stress and burnout, improve school readiness, improve adult knowledge about social emotional development. But how do we do all of that, and where did we start? How do we create an infant early childhood mental health consultation system that was cross-sector, had cross-sector partnerships, and address every need I just mentioned above? Well, here are our top 10 strategies that we use to help make this happen in our state. Funding, our stakeholder engagement, research and recommendations, state cross-sector advisory committee, the model, workforce development, a pilot program, outreach, training and technical assistance, evaluation, and sustainability. These strategies have helped us to begin creating and sustaining a workforce that specialize in supporting the well-being of providers, parents, caregivers, and children. But I do want to quickly highlight what you might notice is missing in our work here, which is policy. But don't fear, we know that policy is coming. We're working on it with our state partners, but we wanted to highlight all of the other strategies that also have to be in play to create the long-term success of a program in partnership and even before legislative policy support happens. So let's dive into these different strategies. For funding and history, we knew our early childhood workforce needed support. We also knew we have a gap in supports for children 0 to 3. And so we had historical grants from both the federal level and state level that were helping us create committees and councils that were thinking about and bringing evidence-based practices to Texas that were supporting families. This was over 10 years ago, this work was happening. And yes, it sometimes takes that long to align all of our systems together to kick off a statewide system. So we want to acknowledge that past. Then in 2020, COVID, everyone was struck and affected by COVID in a personal and professional way. Everyone has a story to tell about their experience, the hardship, and that everyone was impacted. Specifically, though, our state leaders and their families were also impacted. Access to critical early care and education, community-based programming, it was all slowed and everyone felt it. So we in Texas decided to seize on that moment to highlight the need to support the workforce, as all of our workforce are human beings, to highlight the need for quality early care education, access to care, highlight issues around fairness, access, and how we did that was we were able to obtain a grant that helped us launch our first statewide consultation project. For stakeholders, we needed to build the system to support the workforce and children, so we needed the right people at the table who could help us make those decisions. So we engaged our stakeholders through quarterly meetings where we hoped to create shared language, understanding around the project, share updates, and elicit feedback. But the truth is, if people don't want or don't understand the work, it's really challenging to move it forward. So it was imperative that we had our partners with us along the way. In research and recommendations, before we could begin piloting our services, we had the luck of following all the trailblazers who had been doing this work for 20 plus years. We took their successes and their warnings, where they said, don't recreate the wheel, make it better. So we interviewed our 17 states, we created our reports, the landscape analysis, which shared the different case studies from what we were learning, the implementation science report, which helped lay out the recommendations for our state. These two reports showed need, helped create buy-in, and a common language. Then came our state cross-sector advisory committee, which included groups like early intervention, early care education, home visiting, and behavioral health. This group is tasked with creating the sustainability work and the sustainability plan. This plan outlined sector-specific areas that detailed how different and various funding streams could support consultation and should pay for the work, and why that buy-in was so important. You can find that report on our website. Let's talk about the model. As many things go in life, we began to build the statewide system while also setting some of the standards at the same time. We learned from our national scan and research that communicating what consultation is challenging. We created a set of recommendations in our implementation science report, and we began creating the statewide model. So yes, we began running the train and laying the track at the same time. Pros and cons, but primarily this had a lot to do with our funding and our timing. Jenny went over the model with you, that physical document, and its areas so that we want to detail that it's meant to answer the big questions. What is infant early childhood mental health consultation? Who provides it? Where does it happen? When does it happen? And who does it help? That model took us 2 years to develop and write and was approved by our partners and is now influenced, of course, by our research, but is now helping to pilot our work forward. Another strategy we looked at and used to develop our system was the workforce. In order to support providers and the children, you have to have people who know what their jobs are like, to know their populations, what their professional needs are like, that come from their communities, and someone who has unique expertise in mental behavioral health. Texas does not currently have a direct pathway for creating infant early childhood mental health consultants. And so we created access and opportunities for licensed mental health providers to get training to feel confident to step into that role. The seventh strategy we used was the pilot itself. The Texas Institute for Excellence in Mental Health contracted with 8 community-based sites who hired 11 consultants to cover 10 counties in the state. Our sites covered early intervention, early education, home visiting, and pediatric settings, all at the same time. The Institute provided training and technical assistance to help those new programs get up and running, including peer learning, reflective supervision, training, and evaluation. The last 3 major strategies we employed were outreach, evaluation, and sustainability. We understood from our national scan that outreach about what consultation is and how it supports early childhood workforces and how we communicate that was critical. We recognized the need for a statewide outreach plan, so we created the brochure about consultation, the state agency level logo, which everyone can use. We created conference posters, one-pagers, all of the services and the resources you can find on our website. The promotional videos Jenny mentioned, we encourage you to go check them out. They're fantastic. We created them so that folks could understand and see what it might look like on a day-to-day basis. Then evaluation. We all know evaluation is key. We created a project evaluation plan, a logic model, and took the opportunity to pilot various measuring tools. We'll share some of those in a minute and some findings from our pilot's evaluation. But the goal was to help inform our state and local leaders what the needs were and what the early childhood workforce needed and how we were going to address them. Then to show the results so that we could make our decisions based on data moving forward. And then sustainability. We all know you have to consider sustainability while building programs. So in addition to our state advisory committee, we are part of a national peer learning collaborative on infant early childhood mental health consultation systems building, and we learn from those other leaders. We've built an interim and final sustainability plan outlining why each sector should invest, and we, of course, are continuing to apply for more funding. So what are we doing to understand if our services are working? Please note our pilot was great in that it offered us a unique opportunity to pilot different measuring tools at the same time to see which ones would be the most effective for our populations, our state, and our work. The DECA and ECBs are looking at child behavior and the relationship between a child and caregiver. Ages and stages questionnaires, we're looking at the physical, social, emotional, normative development scales. The ProQual are measuring changes in burnout, trauma, and work satisfaction levels for providers and so on. So we wanted to share and show with you the depth at which that we're working to try to understand if our service delivery is making a difference, what the impacts are, and the experiences of the participants in it.
So let's look at that a little bit further and what we learned in our PDG pilot. So we're going to go over a few key highlights that we have also listed in our evaluation report, which is available for download on our website. We first looked at cases that involved one child, and those are called child and family focused cases. We used the DECA infant toddler and the DECA clinical to determine these outcomes. The DECA IT, or infant toddler, is for children 0 to 3, and the DECA C, or DECA clinical, is for children 3 to 5. Both of these tools use T-scores and consider a range of domains, including things like attachment and relationships, initiative, self-regulation, aggression, depression and withdrawal, among others. We looked at whether or not infant and early childhood mental health consultation services are associated with a reduction in problematic behaviors in children, as well as associated with the promotion of social emotional skill development. So what we saw overall was that mental health consultation improved protective factors. And of course, we know that this in turn supports long-term child development. Specifically, though, we saw increases in attachment, self-control, and initiative. We also saw that the total behavioral concerns decreased, specifically in regard to aggression, withdrawal, depression, and emotional control issues. So for cases that involved a classroom, and we call these classroom level cases, we used the pyramid model's teapot for preschoolers and tippy toes for infant and toddlers. These tools consider classroom practices, environment, and teacher behavior. And what we saw for infants and toddlers in the classroom was positive increases in classroom practices with those teachers who participated in infant and early childhood mental health consultation. We found the same through the teapot. For children who are preschool aged, on average, classrooms were provided that were provided infant and early childhood mental health consultation saw an increase of 17.71 points, indicating an increase of usage of positive strategies by those preschool teachers that were engaged in mental health consultation. As part of our larger evaluation, we wanted to understand the impact of mental health consultation services on adults in the child's life. So we used a tool to measure provider well-being that's called the ProQual, the professional quality of life. And it's a validated self-report instrument that's designed to assess the positive and negative effects of helping others who may have experienced or are currently suffering from trauma. It measures 3 domains: compassion satisfaction, burnout, and secondary traumatic stress in order to provide a multidimensional understanding of provider well-being and occupational stress exposure. This is where we had a large set of data because we were often able to pre-screen entire teams of providers. The great news is that the post-test scores showed that infant and early childhood mental health consultation services supported a decrease in burnout and secondary trauma, which is exactly what we hoped to see. In fact, there was statistical significance in regard to improvements among providers who completed both pre and post assessments. Overall, we saw a 2.97-point decrease in burnout and a 2.48 decrease in secondary trauma. We also saw a positive increase of 2.48 in compassion satisfaction overall. One of our evaluation lessons learned and a change on how we might do this in the future was that our online system was purposefully set up to link individual, not link individual pre and post responses. We looked at those in aggregate. So the analysis for this work compared them as groups rather than matched pairs. So also an important note was that we dug a little deeper to see if the type of service that was received made a difference between the levels of infant and early childhood mental health consultation. So we examined the ProQual scores by child and family focused, classroom group, and programmatic consultation. And what we found was that across all consultation types, mean burnout and secondary traumatic stress scores decreased from pre to post, while compassion satisfaction scores increased. This indicated similar beneficial patterns regarding of how consultation was delivered.
So some of our other evaluation efforts included key informant interviews, where we learned that there was a common theme of value of community and collaboration, which is where you see the quote on your screen. The community referenced is the network of infant early childhood mental health consultant providers that were created through this process and their experiences going through training, reflective supervision, and providing services across multiple systems and agencies together. We also did a participant experience survey, which was primarily completed by the providers and adults receiving consultation. There, we found there was a 90% strong agreement that services were helpful and that they were satisfied. Similarly, we found high positive ratings that consultants were trustworthy, understood the provider's needs, and then met that need. In addition, to better understand how infant early childhood mental health consultation supports the reflective dimensions and practice within receiving consultation services, we used a reflective capacity self-efficacy scale that assesses the professional's confidence in core reflective capacities. Basically, what that means is how are the providers being able to use reflective skills in their work? How can they reflect on their own behavior, their experience, and then how that impacts the work that's going on with their families that they're serving right now? While we had a pretty small sample size for pre-post scales, we saw an overall increased pattern of confidences in the providers to use reflective skills and capacities through consultation services. In pre-confidence ratings, providers felt some confidence identifying a mental health need. However, navigating that need, understanding that need, and then repairing relationships and modeling supports were areas of low confidence. But post-consultation services, respondents increased their confidence levels by 1.13 points from the previous. While these results cannot support kind of our larger claims yet, because it's a pilot project, they are directionally, though, consistent with the intended role of consultation, which is to deepen those reflective capacities, strengthen providers' confidences, and enhance their ability to do reflective work. So let's talk about a little bit of where we're going to go from here. The program manual, the sustainability plan, these are your great places to start. We're continuing to engage with the cross-sector advisory committee. We have secured new funding and have ongoing funding to support consultation work. We're engaging in larger strategic planning and have a recommended statewide evaluation. Our advocate friends are already planning and in talks with us about upcoming legislative session activities. So we have seen successful partnerships between local workforce boards now using their quality initiative dollars to pay for consultation, and our outreach is continuous. In fact, this presentation, we hope you watch it over and over again, is also part of that outreach. We're hopeful that what is to come and continues is sustainability for these services, and we hope that the work that we had just shared with you helps to pave that way. I want to take a minute, though, to quickly highlight those that you might not have seen and those behind the scenes. Dr. Molly Lopez, Mary McCrane, Leah Davies, and Jennifer Oppenheim, some of the masterminds behind helping us lay the foundational work in our state. And then as we move forward, as we're paving this way together, we expect there to be some hurdles and some great lessons learned and continued wins. We're excited for you to listen to this work, to get excited about this work with us. We hope that now you have a better sense of understanding what IECMHC is and stands for, Infant Early Childhood Mental Health Consultation, understanding who provides it, which is those licensed mental health providers, understanding where you might want to look for them and getting excited about maybe where is mine in my region and how can I access them and learn more about it. We encourage you again to watch this presentation as many times as you can to kind of dig in and get engaged with the work that we're doing. Ask about how your state leaders are thinking about consultation services to support your populations. And if you have any questions moving forward, please reach out to the Texas Institute for Excellence in Mental Health to ask about the work moving forward. We're super grateful for your time. Thank you so much.